Good afternoon.
Good afternoon, Madam Chair.
Thank you. I missed Senator Kramer there for a minute.
Good afternoon, Madam Chair.
Today is Friday, April 4th, and you are in the Finance Committee. Thank you for visiting us. We're going to have one bill hearing, House Bill 102, and then we're going to vote on about, 6 or 8 bills. So if I can have the Department of Labor come to the table for their testimony, House Bill 102, Family and Medical Leave Insurance Program. Thank you.
Good afternoon, Chair Beidel and members of the committee. My name is Regan Vaughn. I'm the Director of Policy for the Family Division at the Maryland Department of Labor, here in support of HB 102. Family is a program designed to provide leave and wage replacement for workers so they can take time to care for themselves and their family members. And the Maryland Department of Labor is committed to delivering this program so that workers can be served both in the near term and for generations to come. I want my kids to grow up and be able to access family. HB 102 is a cross-file of Senate Bill 225, which you heard earlier this session. It was amended on the House side to include some definitional changes, a response to a request from local governmental entities regarding our seating period, and to provide Maryland Labor with additional time to implement the program overall by moving the statutory deadlines for contributions and benefits by 18 months. The delay was requested in order for the department to respond to real and compounding impacts on our implementation timeline. Since we came before you last year, the department was on the front line of responding to the Francis Scott Key Bridge tragedy, devoting significant time and resources to ensure workers and businesses were protected. We've undertaken several major procurements in family necessary to set up the program, several of which were challenged, significantly delaying our ability to move forward with speed. And then finally, the decisions being made now at the federal level are causing unpredictable delays for us. We had a contract with 18F, which is part of the General Services Administration, where they were providing us digital technologists. 18F was dissolved a few weeks ago on a Friday night, and that Monday we lost key members of our digital team who just no longer had positions, and we're pivoting now to replace those contractors. Marylanders deserve a paid family and medical leave program that's efficient, accessible, and effective for generations to come. And to deliver on that promise, we're asking for extra time so that we can give it the attention and resources it deserves to launch this new program. We would respectfully request a favorable report.
Thank you. Are you going to testify for us?
Here just for questions.
Just for
Madam Chair,
questions,
yes.
okay, thank you. Senator Mounts?
Just one quick, what is the delay? What's the time? Because I was reading June 1, 2028, is that?
So contributions would begin January 1 of 2027, and benefits would be in place by January 3rd, which is a Monday of 2028.
Okay, thank you.
Yes.
Senator Kramer?
Thank you, Madam Chair. So quick question. I understand and appreciate you're indicating you need more time, but I've also had messages from folks who are anxious to see the program get up and running who have indicated that the department has on occasion testified that you could be up and running by July 1. Can you share with me the sort of contradictory comments there about when the program could be up and running and that it truly is necessary to have this delay? I guess part of that question is it a delay of convenience or is it a delay of necessity? And like to have a better handle on that and hopefully a very candid, frank answer to that, please.
I'm happy to take that. So for the record, Andrew Fulginiti, Legislative Director with the Department of Labor. It's a delay of necessity. You'll recall that the Secretary was here last year delaying the program. And I think the question was asked at that time, why only a year? Are you sure it's enough time? And I think her answer was pretty clear that the department and the administration is very committed to getting the program up and running as fast as humanly possible. But we are very much committed to a program that when it's launched, it serves the people and the employers that it's designed to. And that we were setting ambitious goals at that time, understanding that there were things that are always outside of our control, from procurements to other things that we knew. At that time, we didn't know a bridge was gonna fall and that was gonna shift our priorities, but we knew there were other things. And so we said, look, if we could always shift the deadline out 2 years. Last year, we could have come and asked for 2 years. But as with anything, if you set a deadline 2 years out, you'll meet 2 years out. You won't get things done sooner. So we were trying to be realistic at that time. And that's also why in this bill, you don't see a 2-year shift. You see 18 months for a very strategic reason. We looked at all the things that needed to be accomplished within the program, from the necessary procurements and underlying technology to the personnel and staffing. And also we're conscious of the fact that the longer we delay, it has a real financial impact to the general fund, right? So administrative expenses are going to have to be paid through general fund expenditures until we're self-sustaining. So we were very intentional. It was very necessary for us to make the shift, to make sure that we meet our commitment, that when we flip the switch and turn this program on, it does what we said it's going to do.
Okay, thank you. Thank you, Madam Chair.
Thank you. Senator Hayes?
Thank you, Madam Chair. Like my colleague, Senator Kramer, is saying, this delay is what number of the number of delays? How many delays have we had prior to now?
The initial bill was passed in '22. I would argue those were placeholder dates that year. It was delayed in '23 and '24.
So this is the third time that it's been delayed.
Yes, sir.
Right, and similar, I've heard the same, which, continues to concern me that we put so much into it, but we are where we are. Thank you, Madam Chair.
Thank you. I have a couple of questions. Sure. When the Secretary was here earlier this year, she talked about 400 pins. Do you still think you need 400 pins? We're in a little bit of a budget crisis, if you haven't noticed.
We have not reduced the number of pins. We're just delaying when and how we fill them based on this 18-month delay. So my understanding is the pins stay with the division, but we won't be hiring at the same rate, especially
So,
this fiscal year.
I met with a group, I think they were called the Collaborative.
Yes.
And they had a large number of boards of eds and counties that were going to participate and buy separate insurance, which they're allowed to do by the law.
Correct.
And then I was told that large companies like Northrop Grumman, for instance, are going to be self-insured and they'll do a program. So how do you know how many companies or people, bodies that you're going to have in this program?
So we don't know right now. We have an actuarial contract where that is one of the deliverables. We want them to explore how different take-up rates of private plans will affect our state program to help us plan for. But also what we are doing is copying what other states have done and asking for a declaration of intent from those employers that do plan on offering a private plan. So through that declaration of intent process, which will begin probably a quarter before contributions begin, we have to relook at the regs for that, we'll start to get more information about who's going to go with a private plan, and then we can plan around that.
Okay, I appreciate that. Senator Guile?
Thank you, Madam Chair, and thank you for being here today. So I guess, but one thing I'm wondering is if you have information, if you'd be able to share, the states that have since passed paid family leave or paid family medical leave, how is Maryland comparing right now based on like timeline of implementation, how the program is running, whether other states are using a third-party administrator versus, I guess an in-house type program, so to speak? I just, this is a program I feel like is important to me. It's important to the people that I represent. I think it's, but maybe if you could just help me understand how other states have done this and, where are we? Because this delay is kind of disappointing.
Sure. We are one of 14 states that have passed a paid family and medical leave program. New York based theirs on their existing TDI program, which required employers to use private plans. So they are a outlier state of the 14 where each employer uses a private insurer to insure their employees, and then the state is more or less an insurer of last resort. They also have a plan, but it's a much smaller market share. Connecticut is the only state to use a third-party administrator, and it is, I believe, only for their benefits piece. So we have a collections piece, a benefits piece, and then a job protection piece. So of those three pieces, a TPA administers their benefits piece. And then the other states are all doing it within state government.
Okay. Is there anything, I guess, I understand that this may be needed, and this, since we're in our second, we're almost close to the end anyway, so I don't know if the timeline, but is there anything that we can look to read, anything that has developed any sort of overall study or give us more information on how these other states have implemented, anything that we can learn from that? If there's anything like that we could read or anything like that, or that would be helpful.
Sure, I can look to see what we can find for you. I will tell you,
like a survey, I guess, or something, like overall, and by survey, I mean like overall looking at all the other states and kind of comparing how they've gotten up running and what are some of the best practices that have been learned since then. So
I'm not sure there's anything exactly on point, but I can pull some resources together for you. I will say also the states meet at least twice a month, sometimes 3 times a month, depending on the collection, to learn from each other and discuss. And our team on probably a daily basis is on the phone with a different state trying to get best practices and ideas. So while I'm not sure I have the documentation for you, there is a lot of interstate collaboration right now.
is that part of any sort of organization or consortium or something like that? Or is that just sort of an informal get together,
Yeah, it started informally. One of the groups, Colorado, pulled the states together, and then NASWA, the National Association of State Workforce Agencies, now has a paid leave section to it that they're building, and they are staffing and trying to give more support to the paid leave states. And then there's also a nonprofit that pulls together a state call. The outreach coordinators have formed an informal network, so it's happening at a lot of different places.
And just one more question, Madam Chair. So, obviously, the U.S. is one of the last, in order to develop this program, which is so sad. But, are in these part of these discussions, I realize there's countries that are very different from the U.S., but do you also look to other countries and how they administer their type of programs?
There's been some pieces we've looked at, especially the studies, but I think the focus has been more on other states, at least for us internally.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you for being here. Thanks for walking us through some of this. So basically, the bill is going to delay the payroll tax program until starting 2027, 2028 implementation. How many active employees are on this program now? Because I've heard reports that it's as many as like 250 to 300 active employees already involved with the paid leave program. Is that correct, or is that a miscalculation?
No, I believe we are closer to about 50 PINs that are filled within labor, and then we have contracts to help support our digital efforts, who are working with us.
So there's some
to build the digital
contractual and then
system.
there's 50 pins. What are those 50 pins? I'm not asking for a detailed breakdown, but what are they mostly engaged in doing right now?
Many are our digital services team that are actually building the systems and the technology. We are writing code in-house with our digital contractors. So that is a big section of the team. We have our own engineers working on it. And then the rest are typically directors or managers who are either looking at hiring plans, working with digital services to incorporate their work streams, and putting together the framework and the plan so that we can build family and not feel like we're building the plane while we're flying it. We want to build it on the ground so then we can fly it.
Well, I agree with that concept. I guess to echo the Senator Giles' question, I mean, I don't know that people are like wanting this because I don't think most people have any idea this is coming. In fact, I think people are going to be really surprised if they started getting their payroll taxed every 2 weeks in June or July. So I think delaying it's a good idea, considering the situation we're in financially and fiscally. But I mean, isn't there, to echo Senator Giles' question, isn't it, there's no other economy of scale or anybody else that's implementing something we can, it's just hard for me to believe that we're going to have 50 or 60 people and contractors working on this and it's going to take them till 2028 to get it done. I mean,
It is a hugely complicated system. A lot of it will have to be set up in 2026 so that we can begin employer registration and to ensure that when the payroll withholding begins, we can accept those wage and hour reports, and we have our financial system set up, an accounting system set up. A lot of other states launched without their financial system set up and now are facing bad audit reports in their legislature. So that's one of the things we want to make sure we have tight before we launch. And so a lot of work is going into just that foundational systems work so that 20 or 30 years from now, my predecessor isn't saying, what were they thinking? We want to make sure we have a system that can last for the years and isn't held together with duct tape and masking tape. We
Well,
really want this
yeah.
to be a model for how you can set up systems in state government.
let me just as a segue, and you all obviously are implementing, not the policymakers, and so you know I'm not trying to get you to speculate necessarily, but when we had this all passed, a lot of us suggested, shouldn't we look at some sort of quasi-governmental? Shouldn't this be more like a, you know, supplemental insurance that you could have a private sector entity do, or incentivize people to go buy it from a private sector entity, or incentivize businesses to go do it with, I don't know if it's Geico or somebody, not Geico, Aflac or whatever, not to name check, but there's different ones that do it. Why should we not, looking at what's happening with this, consider that as an alternative?
So we do have a mixed model where employers can opt out of the state program and use a private plan. So we do expect a robust private market to develop. My understanding is in other states that have recently come online, there's about 24 insurance companies that will likely come to Maryland to offer it for employers where it makes sense. But the private market hasn't been able to solve this without a state framework. And there are going to be employers, whether they're small employers, employers who have a lot of women between 25 and 35 working for them, where rates with a private company are just going to be a lot higher because private companies are allowed to set their rates based on the population at the workplace.
But if we mandate, not to interrupt you, but if we mandate it, which we have, it just feels like we're setting up a whole lot of expensive infrastructure. But that's where we're at. Last question. Thank you, Madam Chair. Let's just, if it's okay, last question. So the fiscal note's gone from $900 million to $1.8 billion, is what I saw. I guess what accounts for that, but also are we going to have to then increase the 0.9% contribution rate?
So I think those early fiscal notes you're referencing, there was no contribution rate set. And so they were looking at contribution rates from other states. I think some of the earliest bills back in 2017 or 2018, put in a placeholder contribution rate that was probably too low and got states like Washington State in trouble for not setting it properly initially. But the experience we've seen in other states is initially you set it higher. Like if you're given a range on where you should set it, you look a little higher on the range to build the trust fund. And in the experience of, I believe, every state except Washington State, as the program becomes more predictable and is implemented, that rate starts to tick down actually a little bit because you can better estimate and you don't have to build, your risk tolerance changes.
Okay. All right. Thank you. Thank you, Madam Chair.
Thank you. And Senator Hirsch?
Thank you, Madam Chair, and appreciate all your responses. But I wanted to go back to the system that we've been talking about. What's the estimated cost to build that system?
I have to go back and get that for you. I don't have that at my fingertips, and I don't want to give you the wrong number.
Is it in the tens of millions or hundreds of millions, or do we know anywhere?
We have 3 contracts. I can get it for you shortly.
Okay. And that has to move forward without getting contributions in yet, right? I mean, that money's being spent,
We're using ARPA funding for that.
ARPA funding?
Yes.
And so there will be no need to do any state funding from that.
So with the budget as introduced did not include any state funding. With the delay, we do need state funding because contributions aren't starting.
Right.
But under the terms of the BRFA, once family begins taking contributions, we have to pay it back over a 2-year period.
Okay. So you'll pay back all the cost to build the system,
The non-ARPA funds, yes.
the non-ARPA funds. And does that include the hiring as well, too? The amount of people that were necessary to be hired to get this started?
Yes, I believe the agreement is any general funds that have been appropriated or will be appropriated,
Would have to
we
be
are
paid
responsible
from
for
the-
paying back.
From the employment tax. It's interesting, we talked about the fiscal note. Lots of times we say bills are killed by fiscal notes. This bill might have been passed by a fiscal note. I mean, you come in with a very low number.
Yeah.
And people might have thought it was a great idea for that number, and then we find out that it's twice as expensive, into the billions. What's concerning is you were talking about the mixed model on how different businesses can participate. Again, given the fiscal condition that the state is in, how does the state plan to handle its employees with this?
I believe you're voting on a bill this afternoon where the state has set up for state employees a plan that matches family. And so they can apply to self-insure state employees and will participate like any other employer who chooses to self-insure.
So the state of Maryland will be outside of the pool and the fund.
They'll still be governed by our regulations. Appeals will still come to us, and they'll still be doing the reporting as other employers. So we think of them as being part of the family system, but their employees are not covered by our state insurance plan.
Right. And will I guess the concerning part, will the state have to pay the contributions into a fund, or because they're self-insured, there are no contributions?
There's no contributions because they're self-insured.
So how do claims get paid?
So instead of someone filing a claim, it's a bank of leave that'll be available to state employees, similar to the parental leave that already exists, but it has the more expansive definition under family.
So because we're the state government, we just essentially are saying you get more leave to their employees? Is that?
My understanding, and I don't work for DVM, is as that is something that they negotiated, and they were already providing 100% wage replacement for parental leave.
Someone's paying for it, right? I mean, if you have employees that are not showing up for work and they're getting full benefits, they're getting paid, and just as a private business might have to do if we need to replace those employees while they're on leave, there's a cost to that, right?
Yeah, I assume so.
Right. Again, and going back to the initial fiscal note and where we are now, I would imagine the state government is one of the larger, not largest employees in the state.
It is a larger, yeah.
It's okay. And I'm also hearing county governments are potentially looking at self-employing state boards of education, have grouped together and doing this. The concern is if all of these big employers come out of the plan, is there enough to handle and fund the plan at a 0.9% contribution rate?
So we'll be looking at our actuarial reports to determine whether we're stress testing that 0.9%. But also you have to remember, even though they're not paying in, they're also not receiving benefits out of the plan. And so it is set up so that we would have a smaller pool, but to make up for the lower contributions.
Right, so smaller pool, potentially, well, would be lower contributions for sure, but you are getting to where, and we've talked many times about the unemployment insurance fund and what happens when people are not work and they're not contributing back into that we run into financial conditions there, solvency fund conditions there, which is, again, just concerning that I think although we're going to delay this further, it would be really interesting to see what other states have done, why Washington failed at that. What has happened, you mentioned some states do allow or some states are running with a private market altogether. Other states are allowing to self-insure. But is there a state that is set up most like Maryland?
Yeah, so there's kind of three generations of states. There are the states that passed temporary disability insurance programs in the 40s, and then in the early 2010s, we just did a presentation on this, added on paid family leave to those TDI plans. And then you have kind of the groundbreaking states who came in and passed paid leave whole. And then you have the more recent states who have come online. So Colorado and Oregon being the two most recent.
Right.
And a lot of us have the same underlying legislation with tweaks. I will say a lot of those states did not include local government or state government at all in their plans or had an opt-in provision. So Maryland was really groundbreaking in opening it up to public sector workers. So I think that's why we're not as concerned about them not participating in the pool itself, because we've seen other states who have been successful without their public sector workers in the family plan. And then Maine and Minnesota will come on, and Delaware will come on next year. And so we'll be watching their experiences as well.
Would it have been a little hypocritical to not require states to be involved in it, yet you're requiring the private sector to have to do this?
Oh, I'm not arguing we should have left them out. I'm saying I think it was great that Maryland did that.
Right.
But the fact that they're participating in a private plan is not overly concerning because of those experiences.
Right. All right. I think, obviously, there's still a number of concerns. I'm very concerned with the amount of employers that are able to opt out, that we are going to see this employment tax contribution rate have to go much higher. And it would be nice to know at some point in time, I'm sure the department will continue to give us updates on the information you're getting through the research of other states. And I'm sure a lot of people do not want to hear that we probably will need to make another decision about this sometime, but we really do need to see if this is viable. And the more and more groups that get out of this, either through third party or through the self-funding mechanism or self-insured mechanism, I think should be concerning to a lot of people. I mean, at the end of the day, the way it's written right now, I mean, this is a $1.8 billion tax on businesses in the state of Maryland. and we're going through a lot of conversation in our current budget about a technology tax that, is 25% of that. And businesses are really concerned about this, and yet we are continuing to, look at and, maybe kick the can down the road a little bit on this one, but it is concerning. And so with that, I just would say I'm looking forward to the research and what you're seeing in other states as far as how it's being implemented and frankly, if it's successful at all.
And not just the research in other states, Senator, but we'll make sure when the actuarial analysis comes out, we'll provide that. And I just wanted to note that on the rate, the legislation that this body passed last year included a rate cap as a reminder. So there is a 1.2% cap on that rate in statute.
But correct, but the fund still has to be solvent. It still
Correct.
has to work.
Correct.
And again, I think that's the concern with the amount of businesses that might opt out and decide to handle it this different way than imposing a tax on their employees as well. So thank you very much. Thank you, Madam Chair.
Thank you, Senator. Do we have anybody else signed up? No. Sponsor only. Okay. I don't see any other questions. Thank you both for being here.
Thank you.
That ends the hearing for today. We're going to wait a few minutes. Tammy's having a little computer issue here, and we're going to set up the voting session.
Madam Chair. Oh,